Welcome back to 15 challenging question series at Nurse Horizon Online. Today's subject is Community Health Nursing. For more videos, please subscribe and share and press the bell icon for timely updates. Question number 1. Health Survey and Planning Committee is established in the year, and the options are 1946, 1962, 1967 and 1973, and the answer is option B, 1962. Board Committee is also called as Health Survey and Development Committee, which was established in 1946. And in 1962, Mudaliyar Committee, which is also called as Health Survey and Planning Committee, was established. After 5 years, that is 1967, Jungalwala Committee was established, and 1973, Kartar Singh Committee was established, and after 2 years of this committee, that is in 1975, Srivastava Committee was established. Question number 2. Community health camp on cancer screening is a part of, and the options are primary prevention, secondary prevention, tertiary prevention and primordial prevention, and the answer is secondary prevention. All of the screening programs were included in secondary prevention, whereas all the health promotional activities such as nutritional counseling, vaccination, all of these are included under primary prevention. Question number 3. Reorientation of medical education, or ROM, is a contribution of which of the following committee? And the options are Kartar Singh Committee, Srivastava Committee, Jungalwala Committee and the Bajaj Committee. And the answer is option B, Srivastava Committee. Village Health Care Scheme and Reorientation of Medical Education was the major agenda of Srivastava Committee. Introduction of Multi-Purpose Health Worker was the major agenda of Kartar Singh Committee. Integration of Health Services was the major agenda of Jungalwala Committee. Introduction of Primary Health Centers in India was the major agenda of the initial, that is the Boer Committee. Health Manpower Policy was the major agenda of Bajaj Committee. Question number 4. Which of the following is expressed as proportion? And the options are couple protection rate, infant mortality rate, maternal mortality rate and incidence. And the answer is couple protection rate. Rationale: incidence and IMR, infant mortality rate, are expressed as per 1000, that is rate. However, prevalence and couple protection rate are expressed as per 100, that is proportions. Maternal mortality rate, or MMR, relative risk, sex ratio, these are expressed as ratios. The current question was couple protection rate, which is expressed as per proportion. Question number 5. The most appropriate time for IUD insertion is, and the options are 2 days after ovulation, around the mid of cycle, immediately after menstruation, during or within 10 days of menstruation. And the answer is option D. The most appropriate time for IUD insertion is during or within 10 days of the menstruation. The rationale: the best time for IUD insertion is during or within 10 days of beginning of menstruation. What happens in this period? The greater diameter of cervical canal decreases the risk of expulsion and pregnancy in this time period. Another important question related to this is the best time for breast self examination is after 1 week of menstruation. Question number 6. One multi-purpose health worker is recommended to cover a population of, and the options are 1000, 3000, 5000 and 7000. And the answer is one multi-purpose health worker will cater a population of 5000. One ASHA worker is for 1000 population, one trained DAI is for 1000 population, and one village health guide is for 1000 population. However, one multi-purpose health worker is to cater around 5000 population, and 30,000 population is under one health assistant, male or female. Number 7. The diluents used for reconstituting measles vaccine is, and the options are normal saline, distilled water, aluminum hydroxide and magnesium. And the answer is option B, distilled water. For the rationale, diluent for BCG vaccine is normal saline, but the diluent for measles vaccine is sterile or the distilled water. Stabilizer for OPV vaccine, oral polio vaccine, is magnesium, and the adjunct for DPT vaccine is aluminum hydroxide. The question was diluent for measles vaccine, and the answer is sterile or distilled water. Number 8. The mosquito commonly called as tiger mosquitoes are, options are Culex mosquito, Aedes mosquito, female Anopheles and the male Anopheles mosquitoes. And the answer is option B, Aedes aegypti. Mosquitoes are also called as tiger mosquitoes because of tiger shaped appearance on their body. Question number 9. Vaccine carriers are used as cold chain component at which level of healthcare delivery system? And the options are state level, district level, PHC level and the subcenter level. And the answer is subcenter level. Let us go for the rationale. Walk-in cold rooms are used as cold chain component at the state levels, and large ice line refrigerators and large deep freezers are used as cold chain component in the district level. Small ILR and small deep freezers are used as cold chain component in the PHC level. And the last, that is the vaccine carriers, are used as the cold chain component at the subcenter level. In this 3 months, all the vaccines are kept in the walk-in cold rooms, and in the district and the PHC level, ILR and deep freezers keep the vaccine for a period of 1 month, and vaccines will be keeping in the subcenter for a period of 3 days, 2 to 3 days, that is 48 to 72 hours with the help of vaccine carriers. Question number 10. All are live vaccine except BCG vaccine, DPT vaccine, OPV and the MMR vaccine. Here the question is, which one is the live vaccine? Answer is BCG vaccine, OPV vaccine, MMR, all are live, and DPT vaccine is a killed vaccine. Let us go for a rationale of live and killed vaccine. In the National Immunization Program, the vaccines which were routinely given, that is BCG, OPV, MMR, these all are live vaccines. And in that, killed polio vaccine, that is injectable, that is SAC vaccine, and hepatitis B vaccine, followed by DPT. These are the 3 vaccine comes under killed vaccine category of National Immunization Schedule. Question number 11. Billing method is also called as, And the options are symptothermic method, basal body temperature method, cervical mucus method, and the calendar method. So then another name for billing method is cervical mucus method. Mean by these billing method, these all are natural family planning method. Billing method is also called as cervical mucus method, in which an increased mucus of the cervix, slippery appearance of the cervix during ovulation is identified. Now in the calendar method, shortest cycle minus 18 day is the fertile period and family planning can be carried out. Basal body temperature method, slight increase in the body temperature is considered for ovulation. And the symptothermic method, the combination of the above three methods, that is the billing method, calendar method, and the basal body temperature method, are togetherly called as symptothermic method. Question number 12. Which of the following vaccine is administered subcutaneously? And the options are BCG, DPT, measles, and the hepatitis B. So the answer is measles vaccine is administered subcutaneously. Let us see, in the national immunization schedule, BCG vaccine is given under intradermal route. OPV is the only vaccine given oral, and hepatitis B and DPT intramuscular route, and the measles is the only vaccine which is given subcutaneously. Question number 13. Midday meal program was launched in the year, and the options are 1961, 1975, 1991, and 1992. And the answer is 1961. Let us go for an orientation of health programs. Midday meal program was established in the year 1961. ICDS scheme was established in 1975, and baby friendly hospital initiative was launched in 1991. Revised National Tuberculosis Control Program was launched in 1992, and NRHM, National Rural Health Mission, was established in 2005. In this, most important point is Baby Friendly Hospital Initiative 1991, ICDS 1975, followed by NRHM 2005. Number 14. Which of the following mosquitoes have role in transmission of Japanese encephalitis? And the options are Anopheles, Aedes, Culex, and Mansonites. And the answer is option C, Culex mosquito. Let us go for an orientation of the three major mosquitoes and its transmitted disease. Aedes mosquitoes will cause dengue and chikungunya. So please remember Aedes dengue. Anopheles mosquito will cause malaria. Culex mosquito will cause filariasis and Japanese encephalitis. 15. Kala Azar is transmitted by which of the following arthropod? And the options are tsetse fly, housefly, sandfly, and the ticks. And the answer is option C, sandfly causes Kala. Let us go for an orientation of arthropod and the relevant transmitted disease. Housefly causes typhoid, dysentery, cholera, and amoebiasis. Sandfly causes Kala Azar. Tsetse fly causes sleeping sickness, which causes scabies, especially Sarcoptes scabi. Before watching the video, check your confidence level by trying the 15 challenging question series at NERS Horizon. Thank you.